Queues make up for the larger part of a hospital visit. Sometimes patients are compelled to queue outside waiting rooms to access healthcare. Though it's not a single queue that leads to long waiting hours in healthcare centers, there are a number of smaller queues involved. Front desk, patient file retrieval, X-ray, blood tests, and many more. One study claims that majority of patients, 78.1%, spend 2 hours or less in the queue before seeing the doctor, and less than 1 hour to actually see the doctor. For something as time-sensitive as healthcare, this spells disaster, and patients know as much. Most of the time, health officers have to go through huge stocks and piles of folders to retrieve patient folders, which sometimes becomes frustrating and leads to long waiting hours. Every aspect of patient experience, from confidence in the care provider to perceived service quality, correlates negatively with longer waiting times. This dissatisfaction affects not only the patient's mood, but the working environment in general. Worse still, it affects their health as well. Long waiting times can lead to adverse health effects such as stress, anxiety, or pain.
Someone. What is your card? Don't know, guys. It's not really going on somewhere.
How can we help you? Okay, give me your name.
Somewhere.
Age?
30.
Which hospital?
Kumasi. The district. Kumasi.
Okay. What medication have you been on before?
Paulcy.
And what?
Disability-adjusted life years are a measure of the burden of disease attributable to undeserved communities and effects on their personal life in general. In Africa, as at 2004, TB accounts for 10.8 million days lost. With the highest TB incidence in Africa, Nigeria in 2015 had a national budget of 257 million. Studies in some developing countries have identified primitive record-keeping systems to be inadequate, with about half of the records, 52.2%, only retrievable within an hour. Many African countries can do better with a less primitive record-keeping system, as it results in overworked and frustrated staff and poor quality of care. Quicker service and shorter queues would result in increased productivity and lower burden of diseases and more efficient healthcare delivery. Reduce the queues, upgrade record system keeping, and save lives.